So von Willebrand's disease is the most common inherited bleeding disorder, and it can present in a very heterogeneous way, but with advancements of coagulation, factor replacements, and things like that, those patients tend to live longer, have less bleeding diatheses, and or actually can have cardiovascular events, although to a lower point than the general population. And so, these is not something that comes about infrequently. We do see patients with von Willebrand's disease presenting with acute myocardial infarction, and it's often very difficult to decide how to manage these patients because, in one hand, they just had a myocardial infarction, and oftentimes in these cases, percutaneous coronary intervention is necessary, as well as antiplatelet therapy. However, there's just not much evidence to kind of show what exactly the risk of bleeding in patients with von Willebrand's disease is. And so our study looked at a national cohort of patients admitted with acute myocardial infarction with and without von Willebrand's disease, and not surprisingly, there was an increased risk of bleeding after hospitalization. And so I think moving forward, it's important to consider these disorders, particularly in the chronic management of acute myocardial infarction, in terms of how long dual antiplatelet therapy is needed and what agents. So I think further research needs to be done to flesh these questions out.